Mr. Patel is a 38-year-old American Indian who presents for a follow-up for his hypertension and diabetes. He states that he's had hypertension for about a year now and diabetes for 5 years. For his hypertension, he takes hydrochlorothiazide, and for his diabetes, he takes metformin. He takes 50 milligrams of hydrochlorothiazide daily for his hypertension, 500 milligrams BID of metformin for his diabetes, and he takes escitalopram for his anxiety every morning, 20 milligrams. He states that he doesn't check his blood sugar often because he doesn't like pricking himself. He also states that he only checks his blood pressure when he goes to the pharmacy, but other than that, he doesn't check his blood pressure on his own. His A1C about 6 months ago was 7.5%, and a week ago it was 9.3. His blood sugar a month ago was 218 random, and 2 weeks ago it was 220. His blood pressure systolic is in the 140s and diastolic in the 90s. So with his medication regimen, it seems like it's not working as well. He also states that he's not eating as healthy. He eats a lot of carbs and fried foods. He also stated that he doesn't really watch what he eats. Sometimes he eats pizza, which could obviously bring up his blood glucose levels. Mr. Patel states that currently he's had an excessive amount of weight gain within the past 3 months. He also states that he's feeling more tired and uncomfortable, and he's been urinating frequently and has been excessively thirsty. He currently is a graduate student. He's not making much of an income. He states that his income is little and his insurance doesn't pay for most of his medications. He's constantly changing them. He denies drinking alcohol or doing drugs. Patel needs to be educated on the importance of maintaining his blood sugar and his blood pressure. We first need to educate him about the importance of taking his blood pressure daily, and also taking his glucose levels so that he can be treated appropriately and he can avoid high blood sugar levels and high blood pressure levels. We also are going to change his medication regimen. We're going to give him lisinopril and hydrochlorothiazide, 1 tablet by mouth daily, and we're also going to do glipizide and metformin, 1 tablet by mouth 2 times a day.